Welcome back to OET Medicine Speaking Roleplay Interventions. In our last episode, we de-escalated an explosive, angry patient on a ward. But today, we are tackling the polar opposite scenario, the one that quietly ruins scores, the polite denial. Imagine a clinic patient whose HbA1c levels indicate severe, uncontrolled type 2 diabetes. But because he feels completely fine, he smile-brushed it off because he is simply too swamped with a corporate restructuring to take daily pills. This is where candidates fall straight into the student trap. They panic, turn into an academic textbook, and try to force compliance. Let's look under the diagnostic microscope to see Dr. Patel's first attempt.
Hello, Mr. Green. Your laboratory results indicate significantly elevated fasting blood glucose. We must discuss initiating a pharmacological management program today.
Look, doctor, I appreciate it, but I'm in the middle of a massive corporate restructuring. I don't have time for daily pills right now. I feel completely fine.
I understand your work is busy, Mr. Green, but diabetes is a silent killer. If you do not prioritize this medical regimen, you could face renal failure or peripheral neuropathy. Can we agree to start the Metformin today?
Let's pause right there. Dr. Patel just triggered two massive liabilities from our communication audit, the jargon wall and the empathy bypass. When the patient explained his immense work pressure, Dr. Patel used a robotic token phrase. I understand your work is busy, but... That completely dismissed the patient's reality. Then he built a jargon wall, throwing terms like peripheral neuropathy at a patient who is already overwhelmed. When you lecture a resistant patient using fear tactics, you build defensive walls, your timeline collapses, and you trap your score at a 330. Let's run the course correction.
Mr. Green, I hear you loud and clear. A corporate restructuring is incredibly demanding, and the last thing you need right now is an overwhelming medical checklist when you are already feeling physically well. Because your schedule is under so much pressure, my absolute priority is working with you to find a realistic, highly manageable strategy that protects your long-term health without disrupting your professional commitments. Before we look at any medication, could you walk me through what a typical daily routine looks like for you? That way, we can see what fits naturally into your day. How does that sound?
Notice the transformation. Dr. Patel didn't change his accent or his grammar. He replaced conversational passivity with structured clinical leadership. Whether you are dealing with an angry patient or a quietly resistant corporate executive, the underlying failure is the same, the consultant gap. You are approaching the room like a language student rather than a clinical peer. And if you want to stop guessing why your score is stuck at 330 or 340, you need to diagnose your specific communication liabilities right now. Click the link in the description below to run our free 60-second consultant gap audit. Within 60 seconds, it will pinpoint your exact structural leaks and show you how to close them. Run your audit now, and I'll see you in the next episode.